The House will come to order. Prayer by the chaplain.
Let us pray. Almighty God, we come before you toward the beginning of this legislative session, asking you to pour forth your grace upon these elected representatives in the coming weeks and months. Give them a generous portion of your Spirit, a spirit of wisdom and understanding, a spirit of counsel and might, a spirit of knowledge and reverence for what is right, that they may faithfully and with wisdom accomplish their appointed tasks for the common good of all the people they are privileged to represent. We make this prayer in your powerful name. Amen.
The chaplain for today is Deacon Nathan E. Allen from the Archdiocese of St. Paul in Minneapolis in St. Paul, Minnesota. Pledge of Allegiance. Please remain standing and recite the Pledge of Allegiance to the flag of the United States of America. The clerk will take the roll. The clerk will close the roll. Quorum is present. Clerk will read the journal of the preceding day.
Journal of the House, 90th Session, 2017, third day, St. Paul, Minnesota, Monday, January 9th, 2017.
If there is no objection, further reading of the journal will be dispensed with, and the journal will be approved as corrected by the Chief Clerk. Hearing no objection, the journal is approved as corrected by the Chief Clerk. Reports of standing committees and divisions. A copy of this order of business has been placed on each member's desk. If there's no objection, the reports will be adopted. Recognize the member from Hennepin, Representative Hillstrom. For what purpose do you rise?
Thank you, Mr. Speaker. Mr. Speaker, I rise to object to the report from the Standing Committee on House File number 83.
We will act on all other reports first and then act on House File 83 after we've taken care of that piece of business. Any other objections to the other reports? Seeing no further objection, the reports are adopted. We will now act on House File 83. Is there any discussion? The member from Hennepin, Representative the member from Ramsey, Representative Lesh.
Thank you, Mr. Speaker. Members, I don't know how many of you are aware of this, but the nature in which this bill passed through civil law yesterday was embarrassing, to say the least. Number one, it was a direct violation of Rule 6.22 under our temporary rules, and that the chair did not take public comment on the nature of this bill, and it passed through in an abbreviated fashion. Now, I understand the chair and many members of the GOP were a half hour late for that committee, while the DFL members and folks waiting to testify waited patiently for a half an hour. That happens sometimes in clement weather. However, that is not a reason to usurp the rules of this institution, but more importantly, to deny members of the public an opportunity to be heard on this bill. We explained to you the consequences of what would happen when you attempted to push this bill through on the first day of our work here. And it didn't work because you didn't have the support of the DFL members, but you decided the following week to still push it through in other ways. And what happened is you have an abbreviated hearing where people don't have the opportunity to be heard on it. We had a commissioner who was there explaining all the things that had to happen for this bill not to be an epic failure, and those were ignored, and it was pushed through to the following, it was pushed through to the next committee. That right now is something that needs to be changed with the re-referral. It needs to go back to civil law where you can have a real hearing on the nature of the bill, and so that all of you can understand what you're really doing with this bill. Commissioner of MMB appeared and stated that the web for this bill, the website would need to be shared, including information on the date of birth, income, and residence. An audit trail would also need to be set up for revenue to audit who is accessing the data. And all of this would have to be done before the data is destroyed. And there was a question from one of the GOP members in committee about how all of this would be verified. And the commissioner explained that because it would have to go through the health plans, the fact that a person has health insurance would automatically be verified. There would be no cash payments to an individual. So you have an opportunity under the governor's plan really to get this done for folks, but instead you're saying, no, we want to have our cake and eat it too, and in order to get there, we're going to trample on the rules and the rights of the public to testify. Now, you may think this is just a partisan attack. Well, first of all, I'm in the minority, so that's kind of my job. But number two, Garofalo knows that. He's done that for years. But the second part is you are destined for a really problematic bill, and you cannot do, as Representative Hoppe said when this bill was brought up the first day of our real job doing this on floor session, and as Chair Scott said the other day, we'll work it out in conference committee. Bad things happen when you do that. Both sides know that bad things happen that you do that. When you run something on the flagpole and see who salutes, you end up with a bad result. So I encourage you, you've already moved the bill on, you can still hear this, have a hearing in civil law on this bill in a real way, and so I would ask that this matter be re-referred from rules back to civil law so we can have a real hearing on that. Thank you, Mr. Chair.
The member from Hennepin, Representative Hillstrom.
Thank you, Mr. Speaker and members. Members, in addition to the fact that there was not a public hearing on House File number 83 in violation of Rule 6.22, members, Rule 4.16 is specifically in the rules related to data practices. Members, any bill that deals with data practices is supposed to go to the Data Practices Committee. And the reason is because we know that sometimes in conference committee, folks make changes in this area that ultimately have other effect in other areas of the law. So members, I brought it up last night to Representative Scott and asked her if she would bring her own bill back to committee so that we could fully vet and make sure these issues are correct. So hopefully she's not surprised today that I'm making a motion to bring it back because I asked her to make it herself to bring it back to committee. Members, this language was amended on in the Commerce Committee to House File 1. And so House File 1 is still moving through the process, and it has this language. What I'm asking is that House File 83 be sent back to the Civil Law Committee so that the committee can actually do its work and get it done correctly. Members, there are some people in the public in the area of data practices that we hear from all the time. They always testify on all issues related to data practices. They were in the room, and they were not given the opportunity to be heard. I don't always agree with them. Sometimes I do, but I believe that they always bring an important point to the debate, and usually it helps us find a hole that needs to be fixed. Members, I think we all agree that protecting the public's data is one of the key things that we need to do around here, because sometimes when government gets too much information about someone, ultimately it ends up in the wrong hands. We need to make sure that we get this language right, and I would ask that you send House File 83 back to Civil Law so we can get it done right. And again, the proposal is going to go forward in House File 1, and you can debate House File 1 and all the other issues that relate to it as that moves through the process. Mr. Speaker, I would ask for a roll call.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Further discussion on the committee report on House File 83. The member from Anoka, Representative Scott.
Thank you, Mr. Speaker. Just to clear the record, there was public testimony taken on this bill. Thank you.
Any further discussion? The member from Ramsey, Representative Lesh.
Thank you, Mr. Speaker. Would Representative Scott yield to a question?
She will yield. Representative Lesh.
Thank you, Mr. Speaker. Representative Scott, what public testimony was taken on the bill?
The member from Anoka, Representative Scott.
Thank you. The Commissioner of MMB was there. He gave public testimony.
The member from Ramsey, Representative Lesh.
Thank you, Mr. Speaker. I think most members of the body know that that's not public testimony. We have, Representative Scott, people who come in to testify on the bill, and we ask for public comment at the end of other testifiers. The Commissioner of MMB was there to speak specifically to the parts of the bill that he was going to have to administer based upon your directives in the bill. That's not public testimony. I mean, that would be if the governor came in and testified. There was no public testimony, members. I ask you to vote green on this motion. Thank you.
Representative Hillstrom.
Thank you, Mr. Speaker and members. I'm actually going to ask you all to open up Rule 6.22, public testimony in the rules. And it specifically says that public testimony from proponents and opponents must be allowed on every bill or resolution before a standing committee, division, or subcommittee of the House. In fact, there was no offer for people who were not in favor of the bill to testify, nor people who were in favor of it. Now, in Commerce, I specifically heard this bill as well, and I specifically raised the issues that that we did not address in the Data Practices Subcommittee, and Chair Hoppe was happy to allow there to be public testimony about those proposals. The problem is people who care about data practices were not in the room. They weren't in the room. So members, again, this language is already in House File 1. This proposal will be moving through the process. I ask that you send House File 83 back to committee so that we have the ability to actually fix what's wrong with the proposal and make certain that when it comes to people's data, so the data they're going to collect is they're going to collect people's tax information. They're going to collect whether or not they have insurance. They're going to collect whether or not they are residents of the state of Minnesota. You are virtually creating a new mini MNsure database set, and you are not making certain that the data requirements are clear in the law and that penalties for improper use are where they need to be. I'd ask you to send it back.
The member from Anoka, Representative Scott.
Just a reminder, there was public testimony given yesterday, and I would urge people to vote against. Okay, the Speaker will clarify which way the votes will go. Thank you.
The motion before the body is a motion to adopt the committee report on House File 83. A green vote would be in favor of adoption of the committee report. A red vote would be against adoption of the committee report. Any further discussion on that motion? Seeing no further discussion, the clerk will take the roll on the motion.
Mr. Speaker.
The clerk will close the roll. There being 75 ayes and 55 nays, the report from the Committee on Civil Law relating to House File 83 is adopted. Introduction of bills. The following House files have been offered for introduction today. The Chief Clerk will give the House files their first reading.
Introduction of first reading of House Files 127 through 178.
First reading, House Files 127 to 178. Motions and resolutions. There are copies of the non-controversial motions at the House desk and online. If there's no objection, we'll take action on these motions first. Hearing no objection, the motions prevail. Motions and resolutions. Do you want
Marquardt moves that House File Number 1 be recalled from the Committee on Ways and Means and be re-referred to the Committee on Taxes.
I recognize the member from Clay, Representative Marquardt, to introduce your motion.
Thank you very much, Mr. Speaker and members. Last Thursday I voted to suspend the rules on House File Number 1 because I think it's important we get this process moving because it's going to be a process where there's going to be a lot of different viewpoints. And we know that no one plan is correct, but we need to start bringing things forward so that we accomplish what all of us on the House floor here want to do, and that's to make sure everyone in the state has affordable and high-quality health care. But as we go through this process, I think it's really important that we make sure we do it right and to make sure we provide clarity to our consumers and those folks who are going to receive those payments. And so this motion is to recall from the Ways and Means Committee and re-refer to taxes because I think there is legitimate questions as to whether or not the payments in House File Number 1 would be considered taxable income under either federal or state law. And we have heard that from the Department of Revenue, some serious questions. In testimony before the State Government Finance Committee, Commissioner Franz of Management and Budget said there is a question there. There is no doubt there is a question, a big question. And you also can look at the fact that this is something, when we pass out the House floor, we want to make sure that it's right because there could be really some big ramifications. And I know what's happened in the past. I remember a sales tax rebate back in the late 90s, early 2000s that went directly to folks, and that was seen as not taxable. But on the other hand, back in 1997 and 98, we had a property tax rebate that went through the income tax code, granted something different, but that later was ruled as taxable income if you deducted your property taxes. So I think it's very unclear, but if we don't get clarification, the ramifications for folks could be really huge because if later on it's deemed to be taxable income, if you go to file your property tax refund, your income's going to be higher. It's going to impact that. The child care credit, it would impact that. So anything dealing with income would have an impact. And we can very simply, because I know the tax committee meets tomorrow, we can send this to tax committee to get clarification, Because I think the last thing we want to do is to have our consumers, those folks we're trying to help who would receive these payments, later on find out that they've got to do something different or it's going to impact their tax liability. And under Rules 4.10, paragraph C, it says, a bill with a substantial impact on the tax revenues or tax policies of the state must be referred to the Taxes Committee. So members, I want to get this done. It's important for the folks in Minnesota to get this done, give them affordable health care insurance. But let's make sure we're doing it right. Let's make sure we've kind of dotted all the I's and crossed all the T's. And Tax Committee meets tomorrow. We can get some clarification on this so it doesn't adversely impact folks into the future. So members, I ask for a recall and re-refer to the Tax Committee. And Mr. Speaker, I ask for a roll call vote.
Roll call has been requested. Seeing 15 hands, there will be a roll call. I recognize the member from Fillmore, Chairman Davids.
Thank you, Mr. Speaker and members, and thank you, Representative Marquardt, for bringing this forward. I have to respectfully disagree with a few things, and I hope we don't send this to the Tax Committee. I think we'd be setting a very, very bad precedent. The claim is that, would some of this income, would these checks be considered taxable income by the IRS, therefore increasing taxes? The tax committee handles issues of policy and finance, but policy, and I do not see where this bill has any, we're not changing tax policy. The House rules are very clear that if you're changing tax policy, we should hear it, but that's not what we're doing. I'd like to give a couple examples regarding the minimum wage. In 2013 and 14, there was an increase, there was brought forward an increase in the minimum wage. My friends on my side of the aisle, the majority of friends on my side of the aisle, claimed that the bill would increase the incomes for many Minnesotans. House File 92 went through Labor, Workplace, Regulated Industries, Jobs, Commerce, and Ways and Means, but it never came through taxes because it didn't change tax policy. Unemployment benefits, issues relating to unemployment benefits do not need to come to taxes. As we all know, UI benefits have an effect on taxable income. Bills increasing or decreasing those benefits do not come to the tax committee because we're not changing tax policy. And I think that the Department of Revenue will very quickly let us know as this bill moves forward how that's going to happen, but we're not changing tax policy. Would Representative Pawlowski yield for a question?
He will yield. Representative Davids.
Representative Pawlowski, would it be fair to say that the average college graduate makes more than the person that does not graduate from college?
Recognize the member from Winona, Representative Pawlowski.
Mr. Speaker, Representative Davids, I think that has been proven time and time again in every state in the Union and perhaps in the entire planet Earth. So yes, that's a true statement.
The member from Fillmore, Representative Davids.
Thank you, Mr. Speaker. Representative Pawlowski. Does it mean then that any time we give greater access to higher education committee or to higher education through different things we do through the higher ed committee or whatever committee it is, do we then need to see those bills in taxes? I would hope not. So I've just listed three items of precedence where we really don't need to have this go to tax committee, but I do respect Representative Marquardt's views here, but I would respectfully oppose recalling and re-referring. Thank you, members.
Any further discussion on the motion? Seeing no further discussion, the clerk will take the roll on the motion. Clerk will close the roll. There being 54 ayes and 76 nays, the motion does not prevail. There is another motion at the desk. The clerk will report the motion.
Murphy E. moves that House File Number 1 be recalled from the Committee on Ways and Means and be re-referred to the Committee on Health and Human Services Finance.
I recognize the member from Ramsey, Representative Murphy, to introduce your motion.
Thank you, Mr. Speaker. That is my motion that we refer House File 1 from Ways and Means and to the Committee on Health and Human Services Finance. And I'd ask for a roll call, please.
Roll call has been requested. Seeing 15 hands, there will be a roll call.
Thank
Representative
you, Mr.
Murphy.
Speaker. And members, we are moving quickly on House File 1. It has moved through a number of committees already. That is good, that is swift, and of course we are working to be competent as well in the work that we're doing. We've had a debate in Health and Human Services policy about the difference between Representative Hoppe's bill, House File 1, and the proposal that came from Governor Dayton. One of the key differences between these two proposals is House File 1 will incur a number of additional state costs, an increase in the state bureaucracy, as we try and implement this temporary one-year plan. We have not seen a fiscal note for House File 1 yet, so we don't know really what those costs will be. But we heard from people in the administration that the additional bureaucratic costs of the implementation of your plan will be upwards of $20 million at the Department of Management and Budget or Revenue. As I looked through the bill yesterday and we heard testimony from the Medical Association opposed to the provisions on surprise billing, it made me think about what is driving surprise billing. And of course, that is because the networks are getting more narrow, providers are being excluded, and so consumers don't necessarily know if their provider is going to be paid for the service that they're providing inside their network or not. Consumers are getting surprised by additional bills. I think in our public programs, as a result, we could see an increase in costs in Medicaid and Minnesota Care because of that surprise billing provision and its impact on the state budget. Further, it is clear in the budget or in the proposal that we see before us that the Department of Human Services is being asked, excuse me, Mr. Speaker, that the Department of Human Services is being asked to work in partnership with MMB to verify eligibility. That is going to also incur costs at the Department of Human Services. We don't know what those costs are because we don't have a fiscal note yet. For those reasons, because we don't have a fiscal note, because we don't know the impact of surprise billing on public programs, and because we don't know what the cost to the Department of Human Services will be when we implement this bill, this piece of legislation should go to the Health and Human Services Finance Committee so that we can hear it there, we can understand what those costs are, and for that reason, I ask you to vote for this motion. Thank you, Mr. Speaker.
Any further discussion on the motion? The member from Washington, Representative Dean.
Thank you, Mr. Speaker, and I would be right there with you if Representative Liebling's amendment had moved forward. However, and we were using the Healthcare Access Fund. However, that did not move forward. There's no jurisdiction within that. If the MDH does accrue costs, that can be transferred from MMB. But as it stands right now, there's nothing in the bill that would indicate that it had to be heard in that way.
Any further discussion? Seeing no further discussion, the clerk will take the roll on the motion. Clerk will close the roll. There being 55 ayes and 75 nays, the motion does not prevail. Announcements. Representative Pepin.
Thank you, Mr. Speaker and members. I move that when the House adjourns today, it adjourns until 3:30 p.m. on Thursday, January 12, 2017.
Representative Pepin moves that when the House adjourns today, it adjourns until 3:30 p.m. on Thursday, January 12, 2017. All those in favor say aye. Those opposed, nay. The motion prevails. Representative Pepin.
I move that the House do now adjourn.
Representative Pepin moves that the House do now adjourn. All those in favor say aye. Those opposed, nay. The motion prevails, and the House stands adjourned until 3:30 p.m. Thursday, January 12, 2017.